Hi, everybody. Welcome to the fifth session of the Near North Environmental Education Center's Symposium on Environmental Health. And we're very pleased to welcome on this final morning of our presentations, our moderator today and 2 days ago. I give you Dr. David Fancy.
So Jack Goodman has been the owner and director of Camp New Moon since 1994. He has worked in various capacities in children's camps since 1975. He's a former board member of the Ontario Camps Association, and prior to that was a member of its Standards Committee. He was also a member of the Society of Camp Directors, which dissolved in 2019 by a vote of the members. He is the vice president of Kids in Camp, a charity established to financially assist families to help send their kids to camp, to an Ontario accredited camp, and has been a professor at the University of Toronto since 1988. So a warm welcome from all of us to you, Jack, and over to you now.
Well, thanks again. Well, the image I've always had in my mind since overnight camps were closed in the spring was how do we get across this impediment called camp closure in the environment of COVID? And it is a terribly daunting task to be asked to be part of a task force that is going to move us from where we're at now to a state of opening as soon as we can in 2021. So let me begin by saying that I'm accustomed to providing disclosures, of course, at scientific conferences. And mine really are only that while I'd love Moses or some divine intervention to occur that makes it easy, it's not going to happen through any effort like that. It's really going to happen by the large collaborative effort of a great number of fantastic individuals who are part of our task force. And the objective, I think, of today is for me to just provide a high-level overview of the challenges that we feel we face in trying to get from where we're at now, which is a formal closure of camps that is still in effect and is just being reiterated by the Ministry of Health, in spite of the fact that day camps are open. And what's the process that we're going to use to get there? So let me just see if I can, there we are. So I don't think I need to remind anyone about the state of affairs now. We're during a terrible second wave with probably a little bit more bad news to come before it gets anything better. But it's hard to believe that we're approaching January in a month and a half, and the 23rd of January is the first day that we had our first presumptive case of COVID-19 in Canada, which was detected at Sunnybrook Hospital. And as we moved through that process, the caseloads became apparent. The World Health Organization eventually declared a pandemic in and around the time of March. And the Ontario Camp Association, the OCA, in response to the growing concerns of whether or not camps would be able to operate, established very quickly in the storm of COVID a task force comprised of a number of experienced individuals from the board and others drawn in to the effort to try to find a way forward and to guide camps through the challenge of whether or not they could operate, and if they could operate, how. Very soon after that date, the state of emergency was announced by Ontario's government under the Emergency Management and Civil Protection Act, and it began the process of various closures across Ontario. And despite a tremendous effort by the task force, in addition to the efforts of a number of other camps, I was fortunate to be involved in the development of a guideline that unfortunately got to the desk just a bit before the government had formally announced overnight camps would be closed. And by June, they had decided that day camps would be able to operate, but overnight camps would be closed for the foreseeable future. And this was the first time in the history of camps throughout North America that any such event forced the closure of their operations. Joss remembers, as my dad, who was the principal of New Moon from '59 until '93, that camps were seen as the haven for various health outbreaks like polio. And it's not that camps were seen to be a place that you would be protected necessarily, but it was an escape route to avoid the numbers of people who might have polio, and it might even provide an environmental respite for people who were vulnerable for it. So here we had it in 2020, where overnight camps were not seen to be safe, and despite a number of successes in the United States that ended up unfolding over the course of the summer, which I'll get to after, we remained closed. And this had, as you can all appreciate, and many of you who are listening may have a very personal story to share about your own experiences if you were involved in overnight camps. But this was a devastating event, and it's the current situation has really led to an existential threat to the camp industry. Time marched on, of course, and day camps were allowed to open, and the Ontario Ministry of Health, through the Public Health, the Office of the Chief Medical Officer of Health, formally provided guidelines and guidance, which is now just being updated again for the operation of day camps. So I won't spend a lot of time going through this flow chart, but it really just reflects the structure of what we've come up with as a functional task force for the Ontario Camp Association. And our approach this time around is a little bit more organized, simply because we have the benefit of time to have learned from what took place in rapid fire in March and April and May last year. And we have a group of individuals that comprise an action committee that links directly with a very strong consultant level of expertise that we've garnered over the past few months. And the lion's share of the work is going to be within the sub-chair committee's work of overnight camps. We have day camps that are opening and are operating, but the current guidelines need updating and significant revision because of certain pitfalls and limitations that exist. And strongly linked to the overnight camp subcommittee is the outdoor education mandate and centers, which is capably led by Marika, who's I'm looking forward to hearing soon after my talk. The key is, how do we get overnight camps and outdoor education centers, many of which operate independently, but a lot of outdoor education centers are embedded within the overnight camp operations. How do we get them open, and how do we convince political and public health operatives that it can be done safely? And as I mentioned before, it takes a village, and there's 5 to 6 members on all of these committees that are working extremely hard to put forward the best argument to public health so that we can be in a position sooner than later to start planning. One of the key goals was to establish engagement. And one of the interesting, if not frustrating, realities is that through the process of last spring, while the task force had a certain level of engagement with public health and the 2 individuals that held the file, there was never a feeling that the Ontario Camp Association and all the expertise that it could bring to bear had a significant role in shaping any type of thought pattern, let alone guidance, for overnight or day camps. The day camp guidelines, which finally came out, were really constructed in a way that was driven by ministries of health, education, and occupational health and safety, with little or no input from the Ontario Camps Association. And one of our first objectives, our goals, was to establish engagement with the Ontario Ministry of Health, because we wanted them to understand and accept the argument that we, the Ontario Camps Association, the people who are the foot soldiers on the ground and are well aware of health issues within a day camp or an overnight camp setting. I mean, after all, we've dealt with H1N1. We've done with communicable disease outbreaks in camps forever. And we follow stringent guidelines within the OCA and, of course, the Ontario Ministry of Health. And one of a major concession of the Ontario government and the individuals who hold the camp file was to allow us to engage in the revisions of the day camp guidance. And this is just fairly recent. And so for the first time, the OCA and the Day Camp Committee had a major role in the latest updates that are coming out very, very soon, specific to day camps. They also have agreed, finally, for us to take the lead and to develop the first draft of the overnight camp guidelines. So we're going to be primary roles. It doesn't mean that they'll accept everything we want, but we'll at least be in the front seat and our hands will be able to get on that steering wheel, as opposed to before where there was no role whatsoever. And I think the other very critical thing is that we have the input of Sick Kids Hospital. The CEO of Sick Kids has established a review team that will work with us. And they are very supportive of overnight camps opening next summer. I think the answer would have been different 6 months ago or 8 months ago. But for reasons that I'll elaborate, and I think everyone is well aware of, there's a tremendous sense of optimism that the compelling needs of children and youth in terms of mental and physical health are screaming for the outdoor, fresh air, productive values that camp can offer in being a very key role for kids next summer. And of course, we're engaging the political operatives. And the challenge is that as what is going on right now in the provincial government is a tremendous cognitive dissonance that exists within the office of the Premier in terms of what to do with the second wave. And there are tremendous forces acting within the Chief Medical Officer of Health's office, how to promote a rapid reduction in the case counts in Ontario, for example, whereas the provincial government wants to do the same, but it also wants to maintain some element of economic stability. So these are the tensions that exist currently, and we have to look at the changing terrain as we offer our input for camp guidelines. So what we're trying to do is we're trying to have an evidence-based approach. We're looking at the COVID science. We're looking at CDC data. There's some very compelling data out of Maine and a number of other overnight camps that in fact operated last summer successfully without an outbreak of COVID-19, using very, very rigid and comprehensive screening protocols and cohorting and some of the other what are called non-pharmaceutical interventions, things that we can do to mitigate the likelihood of COVID entering camps. And of course, having really good strategies to root out and triage suspected cases of COVID so that they don't spread throughout the camp. So the team and Marika and Dana Kronik, Zosky, and are very involved in developing the research base, and that's being completed, and it's going to be used to articulate the successes and failures that existed in various camp locations, and to argue that the risk-benefit analysis, and this is a critical thing within the global context of when we look at risk of COVID exposure, it cannot be considered independent the societal consequences. And I think there's a growing understanding politically within the Premier's office and the surrounding ministries, and within public health, that the economic benefits and challenges have to be considered in the context also of the mental, physical, debilitating effects that COVID-19 has had on children and youth, and how the environmental nature of camp in its outdoor settings and all of the wonderful things that camp can do for youth and children have to be considered in this big picture as well. So that is now inculcated in our rationale, and it will be used as the underpinning of what will become the overnight camp outdoor education guidelines that will allow us to open. And when people are asking me as chair of this task force, what is the likelihood of overnight camps and outdoor education centers opening for 2021? I think the overarching response I give is, if it's not 100%, it's very, very close to that. And that's because of the political and public health desires. And one of the conversations I had, incidentally, with respect to the importance of opening camp is that the public health officials said to us that we've already been called the Grinches that stole Halloween. We don't want to be the Grinches that steal overnight camp next summer. So they want camps to open. They just need to do it in a safe manner. And the very huge challenge now is to see them engage in the current fog of the second wave. And the big challenge that we've had is to get them to see forward into January, February, March, when the second wave will have hopefully passed and much better times are ahead. So the overnight camp guidance is now in development. And what we're going to be doing is through the committee work, have a detailed internal review of the initial draft. It will then go to a panel of expert reviewers within Sick Kids Hospital. And we're also hoping to send the draft to what I would call very critical, if not adversarial reviewers. And these are individuals who have been very critical of the government and believe that the epidemiology, which sometimes overshadows the medical rationale, still allows for camps to open. And this is the biggest nut to crack: how to argue against modeling, which has inherent assumptions built into it. And that in itself is a whole other discussion. Once we get our guidelines to a point that we're absolutely confident, not delusional, but confident, it'll then go into the office of the Chief Medical Officer of Health, where we'll be working in a very iterative process to refine those guidelines, and then to get them into the hands of the Ontario Camp Association, camps, and outdoor education centers that are part of the OCA, so that we can establish field guides so that camps can figure out a way to operationalize this guidance in their own settings. It's complicated. Once it gets into the office,
David
yeah.
here, just to say that we're 17, 18 minutes in, which is totally fine. Just wanted to give you a sense of where we are with time.
Great, I'm just about done, thank you. It's a complicated terrain because these reviews have to be undergo legal and associate ministry input. And so we're hoping that that process goes smoothly. There's going to be a likelihood of rigorous screening protocols that are involved, enhanced hygiene, assessments, cohorting to some extent, where groups begin as small groups and then expand outward. And a lot of this is going to be highly dependent on the advent of rapid access testing. And good news is coming all the time. And this is one magic bullet that we did not have last year. And of course, your guess is as good as mine. But the advent of vaccines, which are now starting to roll out, is very good. And the challenge that we're trying to undertake now is to try to get our staff established as essential workers, as a critical business for society. And these are the next steps of our process. So we're hopeful. We have political support. We have public health support. We're putting forward these key arguments. And of course, what better argument than to have kids outdoors much more than they're indoors. And my final message, of course, is be positive and stay negative.
To do is continue to thrive and adapt to all these new challenges that surely are coming our way.